Would you be okay if I recorded some of our session?
Sure.
Okay.
Yeah.
So I'll just prop that up. So I'm going to get some lubricant for your hands, and I'll be right back. We just have such good conversation. How have your hands been feeling?
It's really funny because they feel a little more achy in the joints.
Okay. So like
They've never really
in the big ones or in the fingers as well?
This one is right here. Well, it's kind of sore there, but my thumbs kind of do that anyway.
Mm-hmm.
But kind of in these, and this one is kind of in the middle two.
Okay.
Mostly.
So kind of, does it feel like it's right in between, or does it feel like it's in each joint? You know what I mean?
Kind of in between, I think.
Yeah, okay, I gotcha.
Yeah.
Yeah.
And they look like, I told you last time, I felt like they were swollen, but I don't know that they were. But my knuckles, see, they look bigger. I don't know, like it's in between them though.
Yeah. That's, you have muscles in between those.
Yeah.
And so, between getting the muscle tightened and connective tissue kind of accumulated.
Yeah.
I suspect that's
I did
a
use
major
this
problem.
right before I came.
Mm-hmm. How did it go?
Well, it feels really good.
Good. Did you notice a change in your range of motion or your comfort?
Yeah, a little bit. I mean, like bending my fingers, like this hand, I could never do that.
Okay, that's
Pretty
great.
much like on my own.
Yeah.
Without using my other hand to push them down.
Yeah.
So yeah.
And was that just after this?
And now, even.
Now.
Yeah.
And how long ago was that?
Sometime this morning, so it was probably after 10, so yeah, within 2 hours, because I was ready to go, and I thought, I'm gonna go try that, because I did my hot wax bath.
Good.
And I thought I'll try that too before I go and see.
Mm-hmm. Doing that right after your hot wax bath is really good.
Yeah.
That's the optimal time to do it. Do you know why?
Not really. I mean, I have an idea in my head.
Sure.
But
Tell me about it.
Well, I think any time it loosens, maybe it doesn't loosen.
You're talking about the wax?
Yeah, or heat.
Heat. Mm-hmm.
Yeah.
Yeah.
You just feel more, kind of like the hot tub.
Yeah.
You know,
limber.
you get in the hot tub and relaxes things.
Yeah.
Is that it?
It is in part.
Okay. I knew there was more to it. It can't be that simple.
So there's the factor of, you feeling nicer, you kind of de-stressing, and so you releasing the tension in the muscles that's active, but more for the structural soft tissue, so the ligament, the fascia, that softens with heat, and it's kind of like the candle wax that we talked about before.
Right.
Where with heat it becomes softer and more pliable, more flexible. So that is also part of why you feel more limber after. Ooh. Where was
You
that?
good, Terry?
Well, it kind of shot up that
You been in the
way.
pool?
Yeah. Okay.
Today it did in the pool?
Try to be a little bit more gentle around there. Sorry.
Like, I don't know, like nervy feeling.
Yeah. There are nerves in there. Try to be a little less pointed.
Okay.
Is your massage gun?
It is.
She used it.
Yeah,
Good. Is it helpful?
I think so.
Hope so.
I don't know. I haven't used it that long, so yeah. And I'm pretty much just doing it like in the palm of my hand,
Yeah.
maybe down my fingers. It's hard to do on the back of my hand.
Yeah. Yeah.
Too bony or
Yeah.
something.
The palm of the hand is going to be your best use for it, and kind of like start at the top and kind of angle it down. That'll be good, as well as just centering it in the middle of the palm and kind of circling it out.
Yeah.
When I do this, are you feeling it more in the webbing of your fingers, or are you feeling it more between your knuckles?
The webbing.
Yeah. Okay, good.
Yeah.
I think we've got some tightness in there. That's kind of, if we're tight here, then no matter how loose we make this, it won't be able to spread apart because it's tied together here.
Gotcha.
So trying to loosen some of this tissue up too.
Yeah.
Do you feel like you've got that problem in the other hand?
Oh, this hand is worse.
Sure.
Yeah. Yeah, this one really never bothered me. I mean, as far as pain or anything, I never did have pain in it. They just didn't want to work.
Sure.
But this one's always been way worse than my right hand.
Okay. And your left hand was never painful as well?
Right.
Or, okay.
Yeah.
So it's just cumbersome doing anything that you need to do.
Yes, because used to, before I started coming, well, I'd gone to the doctor, and he did whatever tests you do, I don't know, like for arthritis and what else was it, something. He didn't find anything. Then he referred me to a hand specialist. So it was like 6 to 7 months that
No one was doing anything for
right,
you.
and it just got worse and worse. Anyway, it got to the point like even going to the bathroom to pull your pants in. I had to do it like this because I couldn't grip.
Yeah.
And then mornings were just, yeah, I kind of had to do that with anything because I couldn't, I mean, I was like at this point,
Mm-hmm.
and I couldn't. So if I wanted, I had to do this. So making my bed was just horrible.
Oh, sure. Oh, goodness.
Well,
Managing a fitted sheet, I couldn't imagine.
almost everything was, yeah.
How's that feel? All decent?
Hmm.
Getting more flexibility this way.
Oh, good.
I mean, I don't know if you remember, I thought you were kind of stuck here before. You tell me.
I don't know, going that way.
Yeah, that didn't seem to be a problem. It was just the fingers going back.
Well, I mean, nothing that I really noticed.
Okay.
So if
Okay.
you noticed it, but yeah, I don't know.
All right. Well, you live with it, so I defer to you.
Mm. Yeah, right there.
Yeah. Try to not do it as intense. So your fingers are touching. That's good. How's that all feel?
Feels good.
Good. Where was that?
Well, I'm not quite sure.
It was somewhere in the middle.
I kind of think it was like right there.
Yeah. Right there?
Yeah.
Yeah. Okay. Yeah, I can feel that.
Oh,
Woo.
I was like over here, more
Yeah.
like a nervy thing again.
Mm-hmm. Try to relax. I'll ease up on the pressure. I want to try to get between your structures. Right there.
Mm-hmm. Well, the inner workings of your body are so complicated, aren't they?
Mm-hmm.
People you just kind of take it for granted till something isn't working right.
My significant other is studying engineering, and whenever I talk about the body with him, he often tells me, and it seems like such a bad design. If one thing goes wrong, then it all just falls apart.
Right. Sometimes it feels that way. Or if it's not one thing, it's another. Maybe not even connected.
He showed you everything over here, right?
But, you know, like you said, maybe they are connected.
Oh, they are.
You don't think so because you think if it's your foot, what's that got to do with like your upper?
Mm-hmm.
But I guess it all has to be connected.
And there are different schools of study, like chiropractors really typically have the perspective that it goes from the top down.
Close your eyes and relax.
And
20
that
minutes.
if the head is crooked or if the head rests on the neck poorly, then the rest of it will
Right.
go like a crooked Jenga tower. But then, so if you fix the head correctly, then the rest of it will settle. That's kind of generally the chiropractor's perspective.
Yeah.
And then massage and physical therapists usually look from the ground up. They look at the feet.
Joey, do you want to get on that
And
traction?
I think it's more complicated than one or the other.
Head over there right now.
I kind of look at it from a pelvis first perspective. I think the hips and the set of the pelvis
Don't worry about those girls.
is really
Head in there
indicative.
anyway. Okay, does that feel okay?
I think that
20,
especially
25
because of
reps,
sitting,
2 or 3 sets.
how much time we as a modern society sit, that's oftentimes a good place to start. There was one of my instructors in massage school worked with a professional race car driver, and he had shoulder problems for 18 years, and they figured out that it was because he was always sitting on his wallet. Even when he drove,
stories like that.
Even when he drove, he was sitting on his wallet, and as soon as he removed that and his pelvis would level out, then his shoulders would level out, and he didn't have a shoulder problem.
Wow. Feels so good.
Good. Do you need that? Okay.
That's a I don't know who you are ringtone. Most everybody has their own personalized ringtone, so I know who it is before I. Now, you know, sometimes like maybe if you called from here, it's probably going to have that ringtone because I don't think I've personalized that. So
yeah.
But I thought after the 31st, you know, open enrollment and stuff is over, I'd quit getting so many phone calls. I haven't quit getting them. But I don't know why. I don't know. It's so annoying.
I have an Indiana phone number, so if anyone's gonna do like a spam call, it's gonna be from a 317 number.
Yeah, most of mine are 417 because I have a Missouri phone number.
So that's a quick way for me to tell if it's a local business or if it's a spam call.
Right. At first, I wasn't sure. Okay, do I answer the 417 because most of my kids and grandkids are there?
Mm-hmm.
What if
But
they
you
didn't? What if they didn't have their phone and they were calling? You know, it's that motherly something.
At the same time, they would have other numbers that they would be more likely to have memorized, and people who would be closer to them if they needed help.
Well, right. And they've all been taught if something, like that, you don't have your phone, it's an emergency, hang up and call right back from the, same number so they know.
Try to relax. Are we okay?
Yeah.
Okay. I'll go slower.
Okay. Or, I don't think it's the slow. It's right under that finger.
Knuckle.
Mm-hmm.
Yeah. I was feeling it. I was trying to chip away at it, so I guess I got in too quick.
I don't know how your hands can do this.
Practice.
That's what Wade says too. What was her name? Erin? Was that the intern or the?
Yeah, from last.
Yeah.
Earlier in the year.
She's so sweet, but she didn't have that,
the pressure.
Get in there and get her done.
Well, you have to
take some practice.
Yeah.
And then she said her hands would get tired.
Mm-hmm. You got to use physics. Or be very strong. Or both.
Yeah.
But I have been trying to work on my strength, but I am actually quite weak.
Well.
People have commented to me about, oh, you have such strong hands, and I'm like, not really. I just know how to
do it.
Use leverage. Yeah. So if I do this, are we okay with that?
Mm-hmm.
Okay, no problems.
Yeah.
Great. You tell me if it starts getting irritating.
Not so far.
Good.
Okay, Annette? So far? Pull two cords off? Yes, perfect.
So I did.
How many did you do?
3 sets with both legs and 2 sets with 1 each.
6 and 4. Well, that's up from last time because you were 5 and 3 last time.
I was also stretching out more in the pool in the deep end. I mean, I feel like this was the first time I felt like I could put my fins back on. Maybe not getting the open ocean, but in the lagoon anyway.
When's your trip?
September.
Oh, long time. How long were you on the bike?
12. 4.
How long were you in the pool?
30 minutes.
You done all your hip stuff you like to do when you're standing?
I haven't. I'll do that one.
Okay, well, let's sit you up and do some leg curls. This is Angela.
Hi, Angela.
I need to introduce you. She's a student.
I'm
She
learning.
just got here within the last hour, so.
Good.
Wow.
charging you for the rest of the
So I'm part of the training unit.
She hasn't been here as much as the guy you met earlier on the shoulder, but she's been here a couple times.
Well, earlier I was here a lot. By the way, is Mark Schwartz still around? Did he take off?
He's retired. He's around, he's recreating a lot.
Me too. Good for him, good for him.
So he's, yeah, I mean, and I know someone just said here recently, he's got a bike trip.
Excellent.
I know last summer he and another guy we always ride together, they were here for that.
Nice.
Okay, Angela, would you just?
So that's going down pretty well.
Mm-hmm.
So now we're kind of stuck in here.
Yeah, it's funny because it wasn't before. I mean, you
That
know,
wasn't your problem area before.
right.
Yeah,
Okay, I need a little more.
that's okay.
Just keeps
This is gonna
I think so.
need some warming up.
changing.
Well, you
Places.
know, even if there is negative change, change is a really good sign because it means it can change.
I'm still
Oh,
sore.
So even if it's fluctuating constantly,
3 weeks ago.
and that's annoying, that's
It is
actually
annoying.
that's actually a decent thing, because the thing you don't want is for it to be unchanging no matter what we do to it.
but if it's not changing for the better, how is that good?
Because it lets us know that there is something that we can do to change it. We just didn't do the right thing.
Gotcha.
And so it's an elimination step at that point. Obviously, we don't want that to happen.
Right.
Obviously, we want to choose the right thing from the start.
Right.
But what that tells us, and how we as professionals try to look at it, is, okay, we can affect this, and these symptoms are not stagnant. And
Okay.
so we just have to figure out what makes it feel better and focus on that instead.
Makes sense.
Yeah. And that's, you know, we don't take the perspective of, oh, I wonder, you know, what experiment we can do on our patients today. It's not that you're our guinea pigs, but we have a lot of science-backed practices that, you know, we see through repetition and through regular implementation of treatment. These are the things that usually work, and that's what we go to first. And then if those things don't work, then it's like, oh, well, we know that doesn't work. Let's try something else.
Right.
Just out of curiosity.
Which was why I was so disappointed when I went to the hand specialist and she had no clue. No clue whatsoever.
What?
More normal.
How old was she?
Should do both.
Probably,
Even's good.
I'm hard at judging ages anymore. I used to be pretty good.
Mid-age or younger, or
30s.
closer to retirement?
No, middle age.
Okay.
I'm sorry, what?
30s, 30 to 40
I would
probably.
expect her education to have included connective tissue, and connective tissue study has been more recent. And so some people who are older, unless they have taken courses specifically about connective tissue, they may not be up to date on
Right.
that information.
Yeah, she wasn't older.
Yeah, so
But I would expect her curriculum when she was going through school to include that.
Well, at least some ideas.
Yeah.
I mean, she did x-rays. I told her I'd had blood tests. I don't know how you do a blood test for arthritis. Maybe it's just the rheumatoid
Probably.
I don't know. But anyway,
Rheumatoid arthritis is what you would test for with the blood,
Okay.
because it has to do with the immune response, antibodies and things like that.
okay. So that wasn't it. And then, I mean, she just told me she didn't have any idea.
Well, I mean,
And what was it oh,
to say she doesn't have an idea about the cause is one thing, but to say she doesn't have an idea of how to begin to help you feel better is another.
well, she didn't know what it was. She was going to send me to somebody to do a nerve test.
Mm-hmm.
Which I did have an appointment. But then, and I had told Wade all this, and he's not going to say whether he thinks I should do it or should not
Sure,
do it.
yeah, he's not going to give advice.
Right. And I said, well,
outside of his bailiwick.
right. I said, I'm kind of thinking I don't need to do that. I don't think it has anything to do with nerves.
And so that's just the conduction study?
I don't know. I didn't do it.
Okay, sure. So when I do that, where do you feel it?
Right there.
Right there? Interesting.
In
Okay.
that one.
Okay.
I know.
Okay.
But somebody, I think it was somebody that I play cards with, they had done a nerve test. And I'm like, I can't even remember how they explained it. But I'm like, because I had no pain,
Mm-hmm.
nothing.
Mm-hmm.
And I'm just thinking, that's not what it is.
Yeah.
So I didn't do it.
When I do that, is that sensitive in through here? Not particularly.
No.
Okay.
It's funny you do that though, because I don't know if it's connected, but like in the mornings when I wake up, depends on what side I lay on, but it's either my left or right side, and like it's my muscles or something, they're just so, my shoulders and arms are just so sore. I don't know if it's, I don't know, but when you start going up, I'm like, oh, maybe there's something to it. I don't know.
I think that it's a contributing factor. How large of a contributing factor? I don't know. Maybe not big, but I think it contributes.
I kind of figured it did.
What I often find is that when people sleep on their side, not even getting into what it does to your shoulders, when people sleep on their side, usually they tend to curl their hand or wrist. Do you know if you do that?
Well, I used to, because when they told me I had carpal tunnel years ago, I had to wear those braces. That was really hard. But so now I try to not. Now, what I do when I'm asleep, I don't know. But I do lay on my hand, one way or the other. But,
Okay, we'll just give it a minute and see if we can do a few of these here in a second.
So if I kind of compress this way, is that okay, or is that painful?
no.
Was it a fall or a
Good.
bang on something? What was it?
I fell on my stairs.
No, doesn't hurt at all.
Okay.
Icy.
Does it feel good at all,
Landed on my
or is it just kind of?
Well,
and it didn't hurt.
Yeah, kind of benign.
yeah.
Okay, good. That's fine.
I mean, I think the pressure feels good,
Okay,
but
good.
I can't get her to stop walking.
So what I'm trying to do here is there's definitely some tight tissue right along through here, kind of around the side of this joint and on top of it, going into your thumb here. You can kind of see it,
oh yeah. Yeah, I've noticed it.
and I'm trying to. Have you played musical instruments, a stringed instrument at all? Okay.
Okay, you know what? If that's gonna hurt you too much, don't do it.
What you can do when you have a stringed instrument is you can take a string, and if it's just a little bit too sharp,
Easier to do it.
you can pull on the string and you can bend the string and it'll loosen it up just a little bit and bring it into tune. And so kind of what I'm doing here is I'm pulling on that tight tissue to flex it and bend it to the side so that it lengthens out.
Next one over. How you doing, Joe? Everything's okay? Okay, come on over. Extra rotation and behind back, so I'm not going where his thumb needs to. In particular. Okay. Head. So right on ankle.
Do you still feel that in here?
Yeah, but it just, well, no.
You're curling more, so that's
yeah,
nice.
Yeah,
Oh, still going.
yeah.
Now you're feeling it in that joint.
Yeah.
Okay. But when I press down more here, where do you feel that?
Kind of somewhere in between. It's like this is stiffer. Like it.
Okay. Does it feel like the bone itself is trying to bend?
No. It's probably really kind of. Oh, that doesn't make any sense. does
No,
it?
that's okay. So you say like right in here between the joints feels stiff,
like it feels like it's really.
and it feels on
pulling.
the top side.
Yeah, pulling right there.
Okay.
I don't know what's there. I know there's something.
There's
there.
tendons.
Tendons.
Yep. So we'll do kind of similar to what I did over here, but across the top.
Yeah.
I've got a couple more minutes.
Yeah, I wish I could sleep on my back. I think everything in your body's better when you sleep on your back, but I cannot.
Mm-hmm.
I love to sleep on my stomach, but that's bad for your back.
Mm-hmm.
So I don't do that anymore. So the only thing left is my sides.
Mm-hmm. Have you tried sleeping on an incline, sleeping with a pillow under your knees?
I do sleep with a pillow between my knees. But I tend to go not exactly up, kind of leaning towards the stomach area.
Okay.
And I didn't notice like my arms and my shoulders waking up feeling sore till my hand issues. So I thought, well, I don't know, maybe it's connected somehow, or I just don't know. It's one of those, if it's not one thing, it's another situations.
I do think that leaning more toward your stomach is less good
I know.
for you.
I know it is.
It is specifically worse for your shoulders.
Yes. And I sleep usually like, well, I like to sleep like this.
That's a good way to close off circulation.
Yeah, but I don't. I usually have this arm up like this or out, and this one under my. I don't know why. I just can't. I don't like my face down in the pillow.
Yeah, sure. This is loosening up.
Good.
I felt it like give right here.
Oh, did you?
Which is why I mentioned it. I was like,
Oh, yay.
That's noticeable. That okay?
Mhm.
There's a little crackle there.
Oh, wow.
Doing okay?
Yeah, it's getting hot.
Yeah, it is.
8, 9, 8 minutes, 10 seconds. That's what I want you to do. Every
And does it feel tight in that same spot? Yeah. Okay.
And,
So I think
in here.
and in through here.
Just right there.
There. Okay. So if we do the whole bit, well, first off, look at that.
I know.
That's great.
That is great.
So, do you do this at all?
Hmm.
Yeah.
Yeah.
Curl your fingers more. There
Yeah.
you go.
Well, normally they won't curl like that, but
Sure. Yeah.
but yeah.
Well, I want you to try to curl your fingers when you do that as much as you can, because if you don't use it, then that's how we lose it.
Right.
So as much as you can, try to get those fingers curled and then put your weight into it. Great. I like the high friction kind of work that we did in through this first finger. How is it feeling between your knuckles? It's got a little bit of inflammation in there because we worked on it, but
Well, this doesn't look as puffy to me as it does right through there.
in through there. But how does it feel
But
on the
see,
inside?
see the
Yeah.
difference in,
Yeah, this is definitely more inflamed.
yeah,
Also, I just worked on this.
right. But it was like that before.
Sure.
Yeah. And to me, that's where, when I say it feels or looks swollen, that's what I'm,
Talking about.
yeah,
Yeah, right in between.
yeah.
So when you close your fist, how does it feel in between in there right now?
Well, in between, I can't specifically tell if it's in between, but it feels tight.
Okay.
You know, just
Does most of the tightness feel kind of like in the digits?
kind of between here and here.
Okay.
Yeah. These up here,
Don't seem to have the tightness in them.
right.
Yeah. Okay. Well, good.
So,
I like how much you're moving your hand.
oh, me too.
All right.